Hello everyone, my name is Dr. Priyanka Saokar. I am owner of World Class Dental Clinic which is located in Pune. So today I am making this video specially for my all braces patient. They frequently ask me why it is recommended, retainers are recommended after the braces treatment, why it is so important to wear retainer for at least a period of 1 year. That is one question, and second question they ask, what if I am not using it, what is going to happen? So today I am going to just elaborate why it is so important and what will happen if you are not using it. So first thing, when you come to any orthodontist, you go to any orthodontist, and that time we will put on braces and we try to move your teeth, you must have noticed that we move tooth from one point to another point. Okay, so exactly how the tooth movement occurs. So when we are applying some forces on the tooth, the force where we are applying force, that side there is bone resorption, because suppose this is the tooth, this is the crown part and this is the root part of the tooth. So this root is supported by the bone. Okay, it is surrounded by the bone. We have to move this tooth forward. Suppose we have to move this tooth forward and it is supported by bone all around. Okay, so we are applying force. Where we are applying force, on that side there will be bone resorption, and exactly opposite mechanism will happen. Where there will be stretch created, there will be bone deposition. So tooth movement occurs with the help of bone deposition and resorption. When bone deposition occurs, it means we are adding bone, and bone resorption means we are removing bone. So this is simple logic. See, we have to, if I have to move anything like any tooth in particular direction, one direction, suppose I am moving it in that direction, we have to remove the bone, and other side bone should be deposited, so that there should not be any mobility in the tooth. Okay, once we do that, the treatment is completed. But what happens to that bone which is resorbed and which is deposited? It is very soft, it is not fully mineralized. When we do the debonding, we remove the appliance. That time, if we are not giving you retainer or you are not using your retainer, that time the soft bone tooth have tendency to go back to its original position. See, because we have done changes in the bone but not in the ligament which is surrounding the tooth, which is attaching tooth to the bone, that is periodontial ligament. Okay, so this is the bone, this is your tooth root, and there is one ligament that is known as periodontial ligament. If I am moving this tooth away from this bone, okay, the bone is deposited here, but the PDL, we have not made any type of changes here. That is the reason that tooth has tendency to go back. Okay, though the PDL fiber rupture, but they don't get fully repaired for that particular time. If the bone is deposited, it is very in very soft form. To mineralize that bone fully, it roughly takes 6 months to 1 year. So that is the reason we ask our patient to wear retainer for a period of 6 months to 1 year. Okay, so we are holding whatever correction we have done through braces with the help of retainer. Meanwhile, that bone will be remineralized, it will be mineralized properly, it will become very dense, very hard, so that tooth should not go backward again. And second thing, same time the PDL, that is the periodontial ligament, will also heal properly, adapt to the new position. So wearing retainer is so important. It is important as a braces treatment, because if you are not using it, teeth will go back to their original position. That process is known as relapse. So that is the reason wearing retainer is so important. So hope you understood my point, why I insist so much wear your retainer properly. Initial days you should eat wear it for 24/7. It is very important for this purpose only. So keep watching, do like my channel, share it. Bye bye, take care.